Hi, and welcome to Askimo TV. I'm talking today to Dr. Vel Sakthivel. Dr. Sakthivel is the lead doctor for the Department of Children's Orthopedics at the University Hospital Southampton in the UK. He specializes in children's orthopedics and sports injuries around the knee. Hi, Dr. Sakthivel. How are you?
Hi, Joanne. I'm fine. Thank you. How are you?
Very well, thank you. Dr. Sakthivel, let's talk today about avoiding pediatric sports injuries. So I'd like to start off with, why do so many children suffer from sports injuries?
I think the main reason, in my experience and opinion, that why more people these days are suffering from it is because more people are doing sport to start with. Okay, they look at their sporting heroes, the football, cricket, rugby, the American games, whatever, and they want to do that. Okay, firstly, probably for fame, be on TV, well known to everyone else, and secondly, probably for the money which goes with it as well these days. So children are into their sport big time now, and they're becoming so competitive. And I say becoming because I tend to see that trend in people increasing in my practice. And so, that itself tells you that more of them will have sports injuries. Now, what we do need to realize is the children, they are growing. Okay, their capacities are slightly different to a full-grown adult, and the family themselves or the coaches should be aware of that. Okay, and they should cater to that individual child, in terms of advice, in terms of looking after them, in order to prevent sports injuries. But the sense is more of them are doing it in a more competitive way. And that is the reason, I think, for increasing sports injuries in the children, in the child.
What are some of the various types of injuries that children can get playing sports?
Well, the main injuries are ligament injuries. Okay, because the bones are quite a different quality to the well-grown adult. Okay, so what happens is they're a bit more elastic. The ligaments attached to the bones, they are the main problems or culprits, as it were, in sporting injuries. However, the presentation is slightly different. If you or I had a sporting injury, so not just a sporting injury or any kind of thing, so you run and you twist and your ankle gives out. Now, what happens is the ligament on the outer side of your ankle will tear, and that is the classic ankle sprain. However, if a 9-year-old runs and does the same injury, what actually happens is the ligament doesn't necessarily tear, it pulls off a piece of bone where it is attached to. Okay, and so X-rays and things like that are done, and they show a piece of bone floating around, and they think it's a fracture. Essentially, it is, but the bigger picture, it is a complex sprain. Okay, so the common types of injuries are ligament injuries, presenting slightly differently. Also, the ligaments can be a small ligament, can be a big ligament. As I described, the ankle ligament is one of the smaller ligaments. You can have the anterior cruciate ligament, which probably your viewers would know as ACL, the shorter form. Now, that is the bigger ligament inside the knee, and that can get injured as well. So you can have a small ligament, a big ligament injury. Okay. And also you can have bony problems like the kneecap injury, where kneecap gives out or kneecap dislocates. Those sort of injuries can happen as well.
And what would treatment be for some of these injuries?
Okay, we need to find out how bad the injury is. It could be a partial tear. It could be just a stretch of the ligament. It could be a complete rupture. And the treatment depends on which of these injuries has actually happened to that particular individual. And then we can initiate treatment. Usually in most ligament injuries, we are looking at a period of rest, a period of splintage, which may be in a plaster of Paris splint, which may just be in a form of a removable shoe, a removable boot. Then rest, take some painkillers, and review them again in a few weeks. The partial injuries, the stretch injuries, these things will settle with time. If it's a complete rupture, they usually tend not to. So what we do is then we try to go and reconstruct it in terms of surgical reconstruction. However, a period of trial for non-operative management methods is essential, and that would mean rest, elevation, ice packs, painkillers, and all of that put together. And then we would reassess them in clinic to see how well they have responded to it.
Dr. Sakthivel, what should or shouldn't children be doing in order to prevent sports injuries from happening?
Well, that is I suppose, a difficult question to answer, because the easiest answer to that question is they shouldn't be doing sport. Then they won't have sporting injuries, okay? But then there won't be a job for me to go and treat them, okay? So I think, and also to be realistic, that is not the right thing to do. You can't just be sitting on TV all the time. So when you do sport, first thing, you should be aware that you can hurt yourself. You have to also be aware of your limitations, and this is just not the child. You can't expect a 9-year-old to be aware of the limitations. I'm talking about the whole family and the coach and people to put together. So this awareness should be there. Secondly, the awareness should be there to actually identify an injury which has happened. Now, some injuries are very dramatic. They fall down, they have a swollen knee, they can't play again, they can't continue with that football game. So that's kind of easy to pick up that they've had an injury. Sometimes it's like a stress fracture, and you just have the niggling ache after running across country for about 10 minutes, but then they think, oh, it's only an ache, so let's carry on, and that puts more stress on the system, and a simple injury which would have been treated by rest will then subsequently be required to have an operation on it. And so that is where the awareness of the coaches, awareness of the child and the family is very important. And nearly all coaches I've actually seen and talked to in my practice have got this awareness, because these days you've got to do specialized courses, specialized medical first aid courses and things like that to become a professional coach. It seems that I'm talking about the coaches all the time, but they really form a very vital part in preventing sports injuries, and nearly all the coaches have got this awareness. But so the awareness should be there to identify a potential sporting injury. And then the third part is, once you're aware that you've got a sporting injury, you should be aware of the available treatment methods for it, okay? And we can get these children back into sport, back into their real same levels of activity. I mean, I see a lot of national and county players in various sports in my practice, and these people, we tend to get them back, into their same level of activities, not straight away, but after a few months of treatment and rehabilitation and physiotherapy and things like that. So that awareness that, yes, I've hurt myself, but there is something out there for me to have treatment and go back into sport. So these three things will be essential, in order to either prevent or have their injuries treated.
Thank you, Dr. Sakthivel. Thank you so much for talking to me today.
Thank you very much.